It's lovely to join you. As Sophie said, I'm based at the University of Leicester and Partners RSS Hub, where I'm a senior qualitative advisor, and I'm also our EDI lead and our training and development lead. And I also have a role working with the NIHR RSS National Collaborative, which kind of provides coordination and opportunities for kind of joint working for all of the different RSS hubs and specialist centres, and I lead on equality, diversity and inclusion with them. Okay, so what I'm going to talk through today is the importance of research inclusion, which encompasses equality, diversity, inclusion and equity, as I'll go on to describe in a moment. And I'm going to start by setting the scene around why research inclusion is so important in research more generally, and why it's become particularly key in terms of preparing your NIHR funding application. And then I'm going to talk about how you can work towards embedding research inclusion in your funding application through each stage of the project lifecycle. So some key terms to start off with then. So I've mentioned already the equality, diversity and inclusion, and also equity are important to sort of set the scene. And when we talk about equality, NIHR's definition of equality is about kind of overcoming barriers and systemic issues and kind of taking a systems approach to dismantling things that stop people from having equal outcomes. Diversity is about making sure that people from a range of different backgrounds and groups are represented in all areas and at all levels of an organisation or a team, for instance. And when we think about research projects, that might be ensuring that there's a good representation of the different groups that are affected by the issue that you're looking at. So it's not necessarily whole population representation. It might be specific to your particular cohort. Something that's really important to acknowledge is that when we look at grant applications and fellowship applications, sometimes there might be quite a lot of emphasis on recruiting a diverse sample, but not so much emphasis on inclusive research practices. And yet diversity without inclusivity or inclusion risks being tokenistic. And so inclusion is about making sure that everyone has the chance to meaningfully be involved, participate, and achieve outcomes and flourish depending on the context. And so inclusion in a research sense means that we need to kind of challenge some of our assumptions, challenge some of our practices, and think about doing things differently so that people can be included in a way that makes activities accessible and meaningful for them. And an additional term that you often hear referred to is equity. And equity is taking much more of a justice-based approach to trying to kind of dismantle some of the barriers that people face. And sometimes there's a bit of a contrast between the idea of equality meaning treating everyone the same, and equity being treating everyone kind of according to their needs. And so that might lead to kind of the decision that certain groups need different measures to other groups in order that they would be able to have equitable outcomes. Now, in terms of NIHR, what we've seen, particularly over the last couple of years, is a shift in terminology from EDI more generally to research inclusion. So you'll hear me talk about research inclusion quite a lot, and other people who've presented may well have mentioned that too. And research inclusion is how NIHR is trying to embed equality, diversity, inclusion and equity across all of the different people that are affected by its work. So that includes research participants, public contributors, researchers, and thinking about staff, committee members and peer reviewers for NIHR as well. Now, in terms of who's included in with the scope of research inclusion, it's really very broad. So we could start off thinking about the 9 protected characteristics in the Equality Act 2010. But if we stopped there, then we'd be missing out some really key groups and characteristics. And so it's also really important to recognise socioeconomic status or social class, which is such a fundamental determinant of people's experiences and outcomes. And then other aspects such as caring responsibilities, neurodiversity or neurodivergence, literacy. NIHR often talks about underserved groups, and that includes a really wide and quite disparate range of groups, such as prisoners, homeless people, pregnant women, people who have been care experienced, and refugees and asylum seekers, and many, many other groups as well. Other aspects to consider include geography, and there's a couple of dimensions here. There's kind of geography in terms of how research funding is distributed, which is often very uneven. So there are parts of the country where there is very little research activity, even though there are very high health and social care needs. But geography is also pertinent when thinking about choice of sites for research to take place in, and not only focusing on major urban centres, but thinking about coastal and rural areas, for instance. And career stage and sector is another really important aspect of research inclusion, particularly from a researcher point of view. So recognising the particular needs and barriers that early career researchers or practitioner academics might face, and the particular challenges of doing research for people who are based in local authorities or allied health professionals who, for example, get fewer opportunities to participate in research compared to medics, for instance. And so there are a number of different aspects to consider. But it's also important not to think about all of these issues in isolation. And so I'm sure if you look at all of the different characteristics that we're talking about here, you can probably see yourself across multiple different characteristics. And that kind of takes us to the concept of intersectionality and recognizing how these different identities weave together and shape the different ways in which we experience privilege and disadvantage, and how experiencing kind of two different characteristics changes the way in which, you know, we might only kind of experience one of those characteristics in terms of our lived experience and opportunity. So in the sense of why research inclusion matters, you could start off by simply saying that there's a moral imperative to make sure that our research is inclusive and that everyone can benefit from it, which I would certainly advocate. But there is also a business and a scientific case for the importance of research inclusion. And so the first aspect of this is that it's really key that our research is able to identify and target the populations and the geographies where need is greatest. And that doesn't always happen. In fact, we often don't see that alignment of places where the burden of a particular health or social care need is greatest, is not often the place where research is being conducted. But in order to be able to kind of gauge this, we need to make sure that we're collecting data that enables us to do that. And whilst this is improving, there are still many cases where we don't get that demographic data being collected in research, and that's something that NIHR is trying to change. So if we think back to the pandemic, then in June 2020, we already knew that some ethnic groups, particularly South Asian and Black African and Caribbean people, were more likely to have more severe forms of COVID or to die from COVID. And yet, by that point in time, I think there were about 1,100 clinical trials already registered looking at COVID, and this was in Troik et al.'s analysis in 2020. And only 6 of those trials were actually collecting data on ethnicity. And that seems really staggering in terms of being able to understand the needs of people who are being kind of most adversely affected. There's also a need to challenge and change research practices which exclude people who are most marginalised and underserved. And often there's an overlap between people who are marginalised and underserved in the services that they're accessing, and those who are also less likely to be included in research or to feel that research is at all relevant to them. And so it's really important to develop more inclusive and equitable practices, to kind of engage in sort of community engagement approaches, maybe more participatory or co-produced approaches, which I'm sure you've heard a bit about already, in order to be able to kind of engage people and meet them where they're at and help them to understand kind of the benefits of taking part in research and the fact that their voice should matter. We also need to reduce a huge amount of research waste, which results from conducting studies which aren't generalizable to the wider population, which are unlikely to kind of have interventions or pathways that work when then applied to a much more diverse sample or range of settings. And fourthly, we need to know whether some groups are being adversely affected by an intervention or a service or a policy, even if for many people or most people, it's beneficial. And this can be the case with digital interventions, which we know that for many people, there can be a huge amount of value from being able to, for instance, self-manage a health condition or communicate with practitioners that they're in touch with on a digital platform. But for other people, it can exacerbate digital exclusion and might prevent them from being able to easily access the services or information that they need. And finally, we need to make sure that harm is avoided by developing interventions which have been tested on a diverse sample. So later this year, NIHR will be bringing out a sex and gender in research policy. And part of the kind of rationale for that is recognizing that women have been underrepresented in many areas of particularly clinical research, drug trials, for instance, where there have historically been a lot of sort of blanket exclusion of women of childbearing age. And the consequence of that is that when new drugs have been developed and become available to the wider public, we see a lot more adverse events amongst women because they just haven't been involved to the same degree in the kind of testing process. Or those drugs simply might not work for women or could even make their conditions worse. So a key development that has just happened is that NIHR has just made research inclusion a condition of NIHR funding. And this kicked in for all new domestic calls that launched from the 27th of November 2024. So that would cover any calls that are open at the moment and onwards of now. It doesn't currently apply to global health calls, although the plan is to roll that out in the future. And it doesn't apply to all infrastructure awards, though it is being piloted with some infrastructure schemes, but all kind of standard domestic grant and fellowship awards are covered by this. And the key changes are firstly, that inclusive research design has become an explicit condition of funding. So if you don't talk about it in your application at all, or you don't kind of suggest any measures for making your research inclusive, it's very unlikely that your study will be funded. And secondly, there's a requirement to specifically cost for these inclusive design components. So you need to be kind of pointing out at various places in your application, perhaps, but also including in your costings where there are specific costs set aside to make your study inclusive. And this is a really positive development because I've been supporting inclusion in research for about 5 years now in the research support service and research design service previously. And often researchers would say that they're concerned about including all of these costs for inclusive research because it might make their bid less competitive. Whereas the message now is that if you don't do this at all, it will make your bid less competitive. And these changes to make research inclusion a condition of funding will go throughout the researcher journey. So from the standard application form and the applicant guidance, right through to how your study, if it's successful, will be monitored, and publications and how you need to report on EDI in your completed award as well. Now, to go into a little bit more detail about the requirements, there isn't actually a specific section for research inclusion on the standard application form, And so the expectation is that it will be woven through the relevant sections of the application. And so at stage one, the expectation is that you would be discussing inclusion in the background. So that might be providing some information about health or care inequalities and the kind of groups that are kind of particularly adversely affected by the issue that you're studying, the target sample, and any exclusion criteria, particularly justifying any exclusion criteria which could lead to some groups of people being omitted from the study. And at the outline stage, you're not providing detailed costings, but your costings for inclusive research would be part of that overall kind of headline figure that you're supplying. Now, for two-stage applications, at stage two, the detailed research plan will have much more emphasis and space to talk about research inclusion across the whole research life cycle, and I'll explain and unpack what that means shortly. And the costings will be included as a specific research inclusion costing line when you're asked to supply the application budget. So something that we developed prior to research inclusion becoming a condition of funding, but that aligns very well to it, is the Research Design Service Equality, Diversity and Inclusion Toolkit. And the RDS EDI Toolkit is an online resource. You can access it through the QR code, but the link is provided at the end of the slides as well. And it's divided up into 8 domains. These cover the different stages of the research life cycle. And I'm going to take us through domain by domain in a moment. And each domain, you kind of can go onto this online platform and click on it, and it brings up some key questions, guidance, case studies, and then some useful resources as well. So I'd really recommend that you have a look at that and think about which aspects are important to consider for your particular study, because it is often very tailored and personal to what it is you're doing and the people that you're working with. And the RDS EDI Toolkit was developed in conjunction with RDS public contributors who helped to co-develop the public involvement domain in particular. So we're really grateful for their input. So going through domain by domain, the first is historical context and structural inequality. And this is where you're encouraged to kind of look at the previous literature and kind of scrutinize whether certain populations have been excluded in research. And it might be that they simply weren't taking part, or it might be that they haven't been disaggregated in the analysis, or no information has been collected about people's demographic characteristics. And so being able to understand who do we actually know about and who don't we know about could actually help to drive research questions. There's also a need to reflect on different historical and structural issues which might put people off taking part in research, which might have led to mistrust in health and care professionals that often then is also kind of associated with researchers too. And so we know that there have been a number of atrocities that have kind of disproportionately affected underserved groups that mean that there can be a huge amount of mistrust, even though practice has changed in many of those situations. And so the image on the slide is about a study that took place in the West Midlands in the 1960s, where women were given, without kind of clear consent, radioactive chapatis that were delivered to them. And this was South Asian women who often didn't speak good English, if any English. And they didn't know that the chapatis were radioactive, and they didn't understand that they were taking part in a research study, and therefore didn't have the opportunity to give truly informed consent. And this isn't an isolated example. The Tuskegee study in the United States, which recruited African American men, is another example. And although these things we might think, oh, well, it happened quite a long time ago, it stays in the consciousness of underserved groups and leads to kind of fear about what the motives are for wanting to involve them in research. So really good community engagement, public involvement, building bridges through maybe working with peer researchers or community engagement workers are different strategies that can be used to help to kind of build trust and research awareness. In terms of public involvement, I know that Megan and colleagues will have said quite a lot about this, so I won't dwell too much on this slide, but really thinking about, the diversity of the public voices that you're including is key. And I would encourage you to think about that in terms of diversity rather than representativeness, given that you're usually going to have a relatively small number of people as part of a public involvement group. It's probably not appropriate to use the term representativeness, but thinking about how you support and empower that diverse public involvement group, how you reflect on power relations, how you think about the particular model of public involvement that you'll use is really key. The third area to consider is research team. And this can be a bit of a tricky one to think about and to talk about. It can be easier to talk about the diversity of our public contributors or our participants rather than to look inwards at ourselves. But there are real benefits more generally to working in diverse teams and having that kind of cross-fertilization of different perspectives and lived experiences. But it's kind of doing that in a nuanced way rather than a sort of quota tick box way of having people there just because they kind of have particular identities. And what's really key is that the team is culturally competent in the different identities or characteristics that the study is focusing on. And it's important also that you don't just have people there to kind of make up numbers, and that people with kind of diverse lived experience are able to kind of meaningfully shape your research design. There's a really interesting case study of that in the toolkit. And then the fourth area is selection of participants, sites, and samples. And this refers to kind of how generalizable your sample is. And so depending on the type of study, you might need it to be generalizable to a particular population, not necessarily the English or the UK population. It might be a population of people who have Parkinson's disease, for instance, or who are receiving particular social care services, or who maybe live in a specific area that might be sort of piloting new air quality measures, for example. And so, thinking through generalizability and having a representative sample, thinking about more quantitative research is really key. In terms of your exclusion criteria, there are a number of kind of more historic exclusion criteria that I think we need to be a bit more critical of now. So some research has kind of blanket excluded people that are over the age of 65, for instance. And there's a need to think about, is there a genuine requirement to be under a particular age to participate, or are we making assumptions that people that are a particular age aren't able to kind of cope with the demands of research, for instance, because that might be is going to be an inaccurate assumption. Some research will blanket exclude women who are pregnant or who are planning to become pregnant. This is likely to be an inappropriate exclusion criterion unless there is a very strong clinical reason for doing so. And excluding people who aren't able to consent in English is also considered to be something that NIHR committees will pick up on and will ask you to kind of justify and think about how you can kind of remedy through more inclusive approaches involving translation and interpretation, for example. And you also need to consider how you're going to collect data on EDI, on people's different protected and other demographic characteristics, but we'll come back to that shortly. When it comes to data collection, it's difficult to kind of talk exhaustively about this because there are lots of different methods that can be used. But when we were developing the toolkit, I guess initially we started to think about some of the practical measures that you can adopt to make research more inclusive. That might include, as already mentioned, having access to translated materials and interpreters, whether that be for different community languages, British Sign Language, having materials in different formats, having meetings, focus groups, interviews available in a range of different mediums, and varying kind of time of day, days of the week, to be able to kind of accommodate people with different needs and commitments. But some of this felt like we were tinkering at the edges of a number of research methods that kind of have a lot of inaccessibility and exclusion and inequity kind of baked into them. Not deliberately, but because of some of the assumptions about who takes part in research and what they're able to do or not do historically. And so as a qualitative researcher, I know that, a lot of qualitative research involves interviews and focus groups. And when we invite people to those, we expect them to be, fairly confident at being able to answer questions on the spot, to give a fairly coherent account of their experiences or their viewpoints in a focus group, to share their views in front of other people and to manage kind of contributing in the group dynamic. And not everyone is able to do that or wants to do that. So it's really worth thinking about maybe more innovative, creative, participatory methods that can sometimes be kind of more engaging for everyone, not just people from underserved groups, but thinking about approaches such as arts-based methods, photo voice, participatory research, and for trials, thinking about things like remote data collection or community-based recruitment can be valuable too. So it's not always going to be possible, but it is worth trying to think outside the box a bit. And then we get data analysis and presentation. And so you can see that hopefully you can see that I'm kind of tracking each part of the project life cycle. And this is really something you need to do when you're writing your application and thinking about how research inclusion is relevant at each stage. So when it comes to data analysis and presentation, how are you going to describe your participants' EDI characteristics? And this is important because terminology evolves very quickly. If we think about terminology for sexuality, for instance, then the kind of acronym that sort of once was only lesbian and gay and then became lesbian, gay, bisexual, and then kind of expanded to include people who are trans, people who are queer, pansexual, intersex, asexual, and more. Is quite difficult. Some people find to kind of keep up with, and people obviously worry about getting it wrong. But using kind of credible resources, being able to kind of work with members of the public to understand what kind of terminology is and isn't appropriate is really useful there. But also there is a level of subjectivity where terms that work well for one person won't work well for another person. And then when it comes to your analysis, you need to kind of plan ahead for how you're going to use people's EDI characteristics in your analysis. And so for more quantitative research, it's been fairly typical to see demographics listed in kind of the kind of common table 1 and then not referred to in the rest of the analysis. And this is something that we need to try and move away from. By having more disaggregated analyses. That doesn't mean that there's an expectation that samples will always be powered to detect differences between demographic groups, although sometimes that might be appropriate. But it might mean that you conduct kind of more exploratory but pre-specified sensitivity or subgroup analyses. And or that you make that data available for future meta-analysis. And it's also key to think about involving a range of perspectives in the interpretation of results. And so with both quantitative and qualitative research, to think about having different people with different vantage points involved in the interpretation analysis, perhaps sharing and feeding back findings to public involvement group to kind of sense check them, or maybe even training them if they're keen to be involved in actually kind of doing some of the coding and interpretation. And then the penultimate domain is dissemination, implementation, and impact, which I guess we could sort of also sort of think about in terms of knowledge mobilization. So will the findings of your study be shared, disseminated in a range of different formats? What will you do to make them available to members of the public, and particularly make them accessible and engaging to people from underserved groups? In terms of implementation, how will the research be taken forward so that it can be applied across a range of settings and patient or service user groups? And in terms of the impact of your research, it's not a requirement to demonstrate an impact on health or care inequalities. But if that is going to be an impact of the research that you can envisage, then do make that clear. I think that is really important to be able to demonstrate. And so the final aspect is thinking about, well, how much is this all going to cost? So the domain of the EDI toolkit on budgeting outlines different costs that might apply, as well as different kind of time implications of all of the other aspects that I have talked about. And so this might help you to think about what costs are most relevant for your own studies, and to be able to kind of cost those up and include those in your research inclusion budget line. Often the greatest costs are related to the increased time to be able to do inclusive community engagement or public involvement work, or to be able to recruit from underserved groups, rather than some of the kind of other sort of incidental costs. But there are also steps that researchers can take to increase value for money. So I've mentioned translation of written materials, but it's not always appropriate to blanket translate everything into a range of languages, partly because people who speak a language are not necessarily literate in terms of being able to read that language, and some languages aren't presented in written form ever so often, and so it can be a bit of a waste of money and time to do that. And that's why inclusive involvement is really important to help guide those decisions. And there might be outcome measures that have already been translated, so you don't necessarily need to start from scratch with that. And working with peer researchers or community engagement workers can be a really, really valuable way of being able to build bridges between the research team and the communities that you're trying to involve in your research, and can be a kind of fairly cost-effective way of doing that too. So those are a few kind of options to consider. So just to round off, this might seem kind of like a lot to think about if this is quite new to you. I know that some of you will be very familiar with this already, but for others, it might feel like you're kind of in at the deep end. But there are lots of resources that can help, as well as the support that the RSS provides. So you can access the RDS EDI toolkit online, either via the QR code or the link which is in with your slides. But there's other useful links, such as NIHR's research inclusion strategy, if you're kind of interested in that more sort of higher level vision of inclusion within NIHR. But particularly for people who are involved in designing trials, then I'd really recommend the Trial Forge frameworks, which apply to a number of different groups, or the Step Up resources for designing inclusive trials. They're really, really excellent resources. And there is also guidance now for EDI and evidence synthesis that Trial Forge has produced as well. NIHR has guidance on involving underserved groups, including how it defines underserved groups, that I'd commend to you. And the Centre for Ethnic Health Research has a toolkit for increasing the participation of Black, Asian and minority ethnic communities. It also delivers training on both cultural competence and community engagement, and it provides resources on equality impact assessment in research as well. And the final one is the For Equity Health Inequalities Impact Assessment Tool, that is another kind of useful resource, particularly for those who are trying to sort of think about and map health inequalities in relation to their research topic.